Welcome to another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton, and today's guest is a personal and dear friend of mine, Jayne Freeman, who worked with me as my childbirth educator while I was pregnant and supported me as a postpartum doula after the birth of my son, Finley. And today we're going to focus on support for postpartum mood disorders. Jayne Freeman, also known locally as Mama Rama, has been working with pregnant families for nearly 10 years in and around Jersey City, New Jersey, where she's lived for 18. She's a certified childbirth educator, breastfeeding counselor, and postpartum doula, helping families with the transition into new parenthood. For more information, please visit her website at mamarama.tv. Hi, Jayne. Welcome back to Well-Adjusted Mama. I'm so excited to have you on today.
Hi, thank you. I'm so excited to be here.
Yeah, so a few years ago, you did an interview on Well-Adjusted Mama discussing, we talked about postpartum doula and other work that you were feeling passionate about. And today we're going to switch gears a little bit and really focus on a topic that I know is really near and dear to your heart and something that I see a lot in my practice. And I'm really excited to get some evidence-based research facts out to this audience to really learn more about support for postpartum mood disorders. So, this is a controversial topic in some ways. Let's get right into it. What is postpartum mood disorders and who's at risk for this?
Well, a postpartum mood disorder is now what we're calling anything that falls under that umbrella. So that includes postpartum depression, of course, because that is the most well-known, but it also includes postpartum anxiety. It can include postpartum OCD. It can include a variety of mood disorders, and the most rare of all of them would be postpartum psychosis, which is unfortunately what people hear about the most because that makes sort of headlines. Doesn't make headlines if a woman is depressed, but it makes headlines if a woman goes into psychosis and harms herself or her child, right? So, the language has changed a little bit in the past few years. Not everybody has caught up to it, but for the most part, people are referring to any kind of a mood disorder that happens. And sometimes we also say perinatal mood disorders because they aren't always triggered by experiences and reactions that a woman has after she gives birth. So we can see a mood disorder occur while a woman is pregnant. But more often than not, we see this kind of ramp up right after she gives birth. And when you ask who's at risk for this, well, anybody could be at risk for it, really. Certainly women who have had a history of anxiety and or depression are already attuned to this as being a potential issue for them. And they're the ones I find who are the most proactive about their care, which is really interesting because it's almost like they're kind of like anticipating that their mood may go in this direction, and they want to make sure whether they've been instructed by their therapist or it's just good common sense, it doesn't matter. But the point is that they're taking care of themselves in advance. And so that's how I fall into it frequently, is that many women who reach out to me as a postpartum doula already know that they're at risk, and they really want to make sure that they have the support in place that they anticipate that they will need.
Right. I think I do see that in my office. If a woman is, let's say, had suffered from depression, anxiety prior to getting pregnant and had even possibly been on medication, then she's really in this mindset about preserving her mental health and how to do that through psychotherapy or medication. And there's And it's not like something new, a new thing for her, right? Like something that she's been managing possibly for years. And so there's a comfortability with that. And, sometimes with certain medications, like they do recommend weaning off of them during the pregnancy, but she's closely monitored by her doctor to see how she's supported. Some medications are deemed safe during pregnancy. So it's interesting. But regardless, I think to your point, there is an awareness like, okay, all of this mental health support team need to be on board to help support mom after the birth. And that includes the partner as well.
Yes. But I want to also finish answering your question, because when you say who's at risk for this, and I said it really could be anybody, there's that sort of subset of women who kind of anticipate this happening. But then there's a group of women who get completely blindsided by this. And that's really, a little bit more concerning, because there's that I didn't expect it to happen kind of a thing. Why did it happen to me? Why, I'm not technically at risk for other factors, including like a history. But the truth is, it's a snowballing effect. It might be sometimes the circumstances in her pregnancy. A lot of times it's trauma at birth. And, when we say trauma, birth trauma, I think people get an image of just like an emergency C-section, and there was a lot of like concern about the baby before and after delivery and that sort of thing. But I think people don't realize that a birth experience can be traumatic in subtle ways that just they impact the woman profoundly, but on the surface they may seem subtle. Let me give you an example here. One of my clients had given birth and, she had a long labor, and then that ended as a C-section. So that was already, there's a certain amount of emotional work you have to do with that. That's not what you expected to happen. And getting wheeled into the OR and having a C-section is, just that can be difficult in and of itself. But the thing that traumatized her was that this is a consistent problem in New York City hospitals, right? They're overcrowded. Labor and delivery is often jam-packed at many of the New York area hospitals. So getting a private room after you deliver the baby is at a premium. I'm sure you know this. And for anybody listening who is pregnant and considering delivering in New York City, this is kind of one of the factors that could determine, especially for people who live on the New Jersey side, do I deliver in New Jersey or New York? You may be thinking about which is the best hospital, but what I'm about to say can really impact your experience. So what happened was, after she delivered, there's no guarantee that you're going to get a private room. Your name goes on a list. And if, you're not at the top of the list, then you have a shared room. And in 99% of the New York hospitals, if you have a shared room, the partner cannot stay overnight, right? You can't have two women, two babies, and two partners sharing a room. I think only NYU allows that to happen, but only if both parties agree to share. All right. So she had her C-section, unscheduled C-section, late in the day. And shortly after she was wheeled out of recovery and put in her shared postpartum room, her husband was told to leave. Yeah. So she just had no time to process what had just happened to her. So there was the emotional component to it, but then there was also the physical component to it, which was at, nighttime in the hospital, they're just not typically as well staffed, or the staff is just, they're just spread a little bit more thinly. And so when she pressed the buzzer for help, because she could not get out of bed on her own, she could not get up and get positioned to feed her baby. So she basically had to listen to her baby crying. Meanwhile, her roommate was blasting the television into all hours of the night, so preventing her from sleeping even when her baby did sleep. And then on top of it, her husband felt so badly that he didn't even go home. He slept in a chair in the waiting room of the hospital. So this picture I'm painting, although sounds sort of unique to this situation, is not unique in that this is the kind of thing that can set somebody off. Because when she told me her birth story and she got to that part, that's when the floodgates opened. It was the first time she was able to talk about how abandoned she felt. And that was the word that we agreed upon was the most descriptive for what she had experienced, abandonment. So just think about what that feels like as you're coming into this enormous transition in your life. You've just given birth. You have this little tiny vulnerable baby that you have to take care of, and yet you feel that you've been abandoned by the system, basically. Her husband was forced to leave, and she had virtually no help throughout the night.
Wow, that is intense. And stories like that, do sound like, wow, that sounds like a random experience or an like a one-off, but you're saying that's actually quite common and almost expected, I guess, for if you're delivering in New York. And wow, that really is eye-opening even for me. And I can't imagine why it's very normal to feel the abandonment, the fear, the pain, the sadness that all would go into. Ideally, when a woman would be feeling joy, happiness, and elation right after giving birth, and it's quite the opposite.
Right. And so I wasn't setting that up as an example of just, sort of this inconvenience of delivering in the New York area. I was also just illustrating that a single thing that could happen afterwards could be something that could just sort of enable you into spiraling into depression or anxiety. So it could be that, it could be something else, it could be, and most frequently is, something to do with breastfeeding. And that's the other piece that I wanted to talk about, the connection between the pressure of breastfeeding and postpartum mood disorders.
Yeah, let's talk about that, because I certainly see both. I see like a traumatic birth experience for mom or baby and how that can create a mood disorder. But even if the mom has an amazing birth experience, an empowered birth experience, there's a lot of cultural pressure to breastfeed. And a lot of women they're knowledgeable about the reasons why breastfeeding is best, right? Considered best. And they're committed to that, right? Like they might be even committed to that vaginal delivery that ended up in a C-section. So let's talk about these examples you see with breastfeeding challenges.
Well, in the years that I've been doing this, it's become very apparent that women are struggling with breastfeeding and that the pressure to breastfeed is absolutely driving a mood disorder for them, whether that's anxiety or depression or both. And when you said cultural pressure, it's definitely that and more than that. And that's what makes it so scary. Because if it was just cultural pressure, like, for example, there might be cultural pressure. Like at one time, there was cultural pressure to do attachment parenting. And, you could be that person that's like, oh, that does not suit me. I'm putting my baby in his own room, in his own crib, and I'm making a lot of boundaries between me and my baby. I'm not adhering to this philosophy of attachment parenting. Okay. But breastfeeding as a sort of a cultural pressure is broader than that, because it's also a medical pressure. So you have medical professionals, whether they're lactation consultants or doctors, OBs, pediatricians, but most importantly, the hospital staff, the first people to help you in the very challenging first days of new motherhood. Those first people are the ones who are the most tone deaf about it, pretty much across the board. And that's largely because of the very rigid policies of the baby-friendly initiative. Shall I go on?
Yes, please.
So the Baby Friendly Initiative, in case people are not aware of that, is a policy, basically, a series of guidelines and regulations, and not regulations, but just sort of guidelines and new protocols for hospitals to follow in order to promote better health, breastfeeding across the board as a public health issue, a national public health issue. And it was the came up from the World Health Organization and was supported by many different groups and seemed like a great idea when I first heard about it almost 10 years ago, like when it sort of first was like just being discussed in the birth field. I was thrilled about it. I was excited. I was like, in my mind, hospitals and labor nurses were far too pushy about formula, were not supporting the breastfeeding mom, had no clue about the basics of breastfeeding. Like, for example, if you say to a new mom, oh, you're tired from the birth, let us take the baby and put her in the nursery for the night and you get a good night's sleep. Well, that sounds good on paper, but what that does is basically sabotage a woman's efforts to breastfeed, because we know that it's a supply and demand relationship. So if the baby's not there at the breast because the mom is sleeping for 8 hours and the baby's being given formula, you could really mess things up in terms of breastfeeding success, right?
Right, and the milk supply.
Everything from the baby's perspective and the mother's perspective, particularly for milk supply. Yes, because if the demand is not there, if the baby is not at the breast, then the body will close down the supply. I talk about it like it's like a factory. It's like the demand isn't there, so the supply shuts down. All right. So, like I said, that sounded like a great idea in theory, and I don't want to go through the whole, sort of machinations of what's occurred. But if we fast forward into 2019, 2020, we have virtually all the hospitals in the area trying to go baby friendly, except for a handful, or are already baby friendly. The ones that are already baby friendly, that have this particular, they've done all the steps to win this designation, to have this sort of seal of certification. Those hospitals are particularly rigid about breastfeeding in a way that, I don't know if you're aware of this, but if a baby is really struggling with breastfeeding in the first few days and appears jaundiced and, it's really clear that she's not getting enough at the mother's breast, they are not permitted to give formula unless a pediatrician steps in and orders it as though it were a medical necessity.
Right. The baby's dehydrated. Yeah.
Right, which at that point it has become a medical necessity. But let's just, think about how sort of lacking in common sense that is, for it to have gone to such an extreme degree where we're seeing a baby who's clearly jaundiced. And the problem is, in the hospitals, they're not really digging deeper into what the issue might be. For example, I had two clients who had breast surgery, and this wasn't even addressed in the hospital as how this might be a cause of her not having a sufficient amount of milk after she had given birth. Now, this is obvious. When you're working with someone who's breastfeeding, you can typically see, you're looking right at their breast and their nipple. You can see the little scar where an implant had been put in, or where there was perhaps a breast lift or something, right? There's telltale signs. Or at the very least, just ask. And there are other health issues, like, for example, issues with the mother's thyroid that may impact her ability to produce milk, or certain medications that she's taking. But that doesn't come into the discussion in the hospital. They just kind of like have this one-size-fits-all approach, which is you have to breastfeed. It is medically necessary that your baby get only breast milk. We will not be giving you a bottle. We will not be taking the baby to the nursery. We don't even have a nursery anymore, as many of the hospitals who've gone baby-friendly have. Do you know where they put the baby if it's a baby-friendly hospital and they have no nursery and the mom is like, please, let me just get some sleep? They bring the little bassinet to the nurse's station. Baby's just hanging out. Baby's just hanging out, like while the nurses are working on their computers or doing like paperwork. Yeah. I don't know if that's a great thing, but again, what we're seeing here is an underlying we're seeing a sort of, I hesitate to call it a disrespect, but it really is not respectful of the mother's experience, how exhausted she might be, how possibly traumatized she might be, how possibly incapable of breastfeeding in that moment she might be, how all she might need is someone to say, all right, we're going to give this baby a little bit of formula, and then we're going to come back and work with you with breastfeeding, like just to have a little bit of wiggle room for compromise, maybe a combination. But that's not the agenda of this initiative. The agenda is exclusivity. So
what I really heard from you too, and I guess that could be the challenge with a lot of public health policies, is that one size fits all, right? And the reality is that we're all individual. Every mother's individual, every baby's individual, every pregnancy birth is individual. So even if a mother had a wonderful breastfeeding experience with her first child, there could be challenges with the second or third, these are all possibilities. And when you enforce guidelines that are supposed to be applicable to everybody, not everybody fits into that place, and then it does create stress, right? That's the bottom line. When we try to force something, a square peg into a round hole, then we're gonna have an issue.
Well, that is it exactly. This is a one size fits all policy, and it is not respectful to the mother's mental health. In other words, what they've done is prioritized breastfeeding over the mother's condition, her mental health, her physical health, and even her own wishes. So, for example, you could be a mom who maybe just decided out the gate, I'm not going to breastfeed, or possibly was told that she shouldn't breastfeed because she needs to go back on her medication, or she had some surgery, so there's a physiological reason that she won't be able to breastfeed. You put all those moms together and you feed them this idea that they must do this without knowing any of the backstory, then you're really alienating and making those women feel terribly guilty for whatever reason it is that they chose not to or could not breastfeed. So then you have that layer to it, to women who are made to feel in this intense amount of guilt because they're not doing the right thing. And I'm putting that in quotes. They're not doing the right thing because even our language around it, breast is best, that's inherent to that phrase is, well, that must mean formula is worst.
Right. Right.
It's like, well, then what's the opposite of that? Well, that's our formula is not as good. Our formula is bad. There's all different ways that you could interpret what's not said there. And that's a very damaging and dangerous message to put out to women.
Right. I think, and to your point, like we're not talking even like the majority of women, right? And the majority of women are able to have healthy breastfeeding relationships. But when it's not an option for a woman, either by choice or for other reason, how do we support those women and not feeling guilt, not feeling shame, and really feeling, I think it's about the empowerment of the mother here. And especially if she had a traumatic, disempowering birth, it's even more challenging for her to feel, let's say, confident in the decisions she's making regarding how to feed her child.
Well, I have to take issue with that a little bit because I'm starting in the hospital environment, but that doesn't mean that lots of women have success with breastfeeding. It's actually like a prevalent issue. And there's a lot of the narrative around breastfeeding is everyone can do it. That's this natural thing, and that it's very unusual to have problems with breastfeeding. Or it's very, very rare to not have enough milk, kind of a, narrative that goes on. So women are set up to feel like a failure if that doesn't work out for them. And, just keep in mind the statistics on this. The American Academy of Pediatrics recommends exclusive breastfeeding for at least 6 months, and then beyond that, hopefully up to a year. But most women, more than half the babies in the United States, are not breastfed after 3 months. That's really, and then it goes down from there. So maybe 25% of women are able to continue breastfeeding. And a lot of that has to do with, that's not so much mechanics, a lot of that has to do with the factors of going back to work, and that it's just really difficult to keep up a pumping schedule once you've gone back to work. It's no accident that the 3-month mark is when things drop off precipitously, so that's...
Specifically in the United States, right?
Because I'm talking about just the United States, right? I don't have any sort of feedback on like what's happening worldwide, but I will say on a positive note that more and more of the women that I work for are getting more maternity time off. I'm starting to see that 4 months is becoming more of the norm, not 3 months, and I'm seeing partners get a month to sometimes 3 months leave. Sometimes, in some rare cases, the partner gets more time off than the woman who's given birth. And that's
right, because of the job they work for, the company. Yeah, I've seen that too. And what's really cool is sometimes then the father will take some of that paternity leave after mom has returned to work. So it's not necessarily simultaneous, but that way one parent is home with the child. And I think that's really cool.
Yes, right. And they're staggering the care so that exactly. Like he adds on to the end. But again, so let's go back to postpartum mood disorders here, because having support, having your partner around is really important. And I wish that more corporations would take note of how significant that is. There's this still this 1950s mentality of oh, okay, this is women's work, and I'm just going to go back to, I'm going to go back to my professional career and, bring home the bacon basically, and just, she'll do her thing and I'll do mine. When I have to tell you, the moms that I see that are having a much smoother transition into motherhood are the ones whose husbands or partners have been with them by their side for at least 6 weeks or longer. They're so much more relaxed. They have this ability to be like, I don't know, if I need a nap, Steve just takes the baby and goes out for a walk with the baby in the carrier. Something just really simple like that makes a world of difference for the mother's mental health. So this is something that I think is worth paying attention to as well, not underestimating partner support and how really important that could be. And on that note, I want to say that for a lot of moms, the burden of breastfeeding, of having to do all the feeding themselves, yes, the partner can feed a bottle from time to time, but that requires that the mom has to still do work in order to pump milk to get in that bottle so the partner could give that bottle and she could skip a feed. You see what I'm saying? It's still a certain amount of work in order, unless she's saying unless she's also formula feeding, and then we don't have an issue with that kind of, additional workload. But, for the moms who are feeling a little overwhelmed by the rigors of new motherhood, layering on top of that being the sole food source for this little tiny vulnerable baby is sometimes just too overwhelming. So it's what happens at birth. It's what happens in the hospital. It's a lack of support at home. For example, the partners who have to go back to work immediately, and the new mom hasn't lined up any kind of support, or maybe, her mother or mother-in-law can only visit for a week. We don't see extended stays for most people. And some people don't have family they can lean on at all for various reasons. So we can't always rely on that. So there's that. And then there's just the feeling of being overwhelmed by the challenges of breastfeeding. That's, maybe insufficient milk supply, difficulties with latch, painful breasts or nipples, baby's oral anatomy. All of these things can kind of pile on to one another in a way that makes the mom feel very overwhelmed and wants to stop breastfeeding, but also feels guilty about this feeling that she wants to stop.
Right. So let's say, you had shared with me prior to this interview that about 50% of the women that you work with as a postpartum doula do experience some sort of postpartum mood disorder. That's a high number. If a woman is in that position, what would you recommend for her?
All right. So I want to clarify. Sometimes that is something that can be remedied very quickly because it's spiraling into a postpartum mood disorder because of lack of sleep. I think that that's really the driving force there. So it's two things, really. It's easing up on the pressures to breastfeed. And I'll elaborate on that in a second. And it's just having support. And having support, like I said, comes in a variety of ways. A lot of people feel like having a baby nurse is the way that they're going to get that support, only to realize that very quickly that the baby nurse doesn't do anything for you, or they typically don't. And sometimes they don't know enough about breastfeeding to be aligned with the things that you have either learned or been told by other parties who are more knowledgeable about breastfeeding. So a baby nurse should really know about paced bottle feeding. She should know how to do that. She should also know that saying to a new mom who's like just newly home from the hospital and wants to breastfeed, it's not a good idea to say, I'll take the baby for the whole night so you can rest. That would only be in extreme circumstances that you would want to do that, because again, you could interfere with breastfeeding that way. So let me just rewind that for a second. The support that a woman gets afterwards is critically important. If she doesn't feel well supported, and I don't mean somebody just taking care of the baby, she, as a new mother, as an individual, has to feel supported by the people around her. Sometimes the partners are great at this. Sometimes they fail at this. Sometimes they have a baby nurse who isn't addressing this, and that sort of surprises them. Sometimes they have parents who come in who make things worse because of, some previous dynamic that they have. So it can be really hard to get the support that you need, a sort of reassurance, people who know how to navigate this territory in order to not make that mom feel judged or that she's doing a bad job. You'd be surprised how many new moms are in tears because of some innocuous statement that somebody made that made them feel badly about what they were doing. Sometimes it's just the language that we use. So yes, I do see a very high number of moms who are at risk. And that doesn't mean all of them need cognitive therapy or need medication, but I've worked with a lot of moms who need a little bit of push in the right direction. So I kind of refer to that as like she's teetering. She's teetering on the edge of a mood disorder. She could go off that edge, or she could come back on the other side and feel more balanced. And my first line of approach is always to get her more sleep. And that's tricky because that can be at odds with breastfeeding, as I said before.
Right. And sleep is so huge. I mean, anybody who's sleep deprived is going to have an impact on their emotional state. So I guess that goes back to mom sleeping, resting while the baby's resting, and then having her other needs met with support.
Yes, it would be that, but it's a little bit more nuanced than that, because what I see quite frequently is moms who are running high with anxiety, they don't nap. They can't nap. They don't sleep when the baby is sleeping. So now you have an accumulation of sleep deprivation. Sometimes I've encouraged these moms to call their OB and have their OB recommend a sleep aid for them. I don't think that there's any issue with doing that, and almost everything that's out there is compatible with breastfeeding. I have seen a couple of times a practitioner recommending Benadryl or Sudafed. Not a great idea because that dries you up and that can interfere with your milk supply. So that's one thing that I would rather see somebody give a Klonopin than a Sudafed, so that wouldn't be appropriate. You know how if you take an antihistamine, it makes you sleepy. So but for a mom who's got true anxiety, that's not going to do the trick. That's just going to make her it's a drop in the bucket. It's not really going to help. So I was just thinking about sleep deprivation makes, okay. So this is what I wanted to say about breastfeeding, like how those two things could be at odds. Again, she'll be told in the hospital not to give the baby a bottle for 4 weeks. So this is something else I take issue with. And I talk about this a lot with my clients, and I teach it in my class. Once again, we have the Baby Friendly Initiative making a blanket statement about bottle feeding when they're not taking into consideration that you could do responsible bottle feeding. So what I mean by that is I let everybody I work with know that they need to have Dr. Brown's bottles with the preemie nipple. It's got a very, very slow flow to it. And then we have to show the person giving the baby a bottle, whether it's your baby nurse or your partner or a grandmother, that they need to hold the baby in a more upright position and hold the bottle parallel to the floor. So when we do this is the whole point of paced bottle feeding. We more or less mimic what goes on at the breast, in that the baby doesn't prefer the fast, easy flow of the bottle over the breast. That's all we're worried about. That's the only thing. When a baby gets too many bottles in the beginning and those bottles are really fast flow, and all she has to do is just go gulp, 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 and within 5 minutes, 2 ounces are down, that's not compatible with breastfeeding. So let me also back up on this one for a second. Let's just think about this for a moment. When you're told no one can give the baby a bottle for 4 weeks, that means you are signed up for 4 weeks of constantly interrupted sleep, night after night after night. And many women do not have the fortitude to do that, particularly if they're recovering from a C-section. Now, that's really hard. Your body needs to rest in order to heal itself. I always say to people, I'm like, listen, if your partner had a hernia surgery, and that would be considered abdominal surgery, they would come home from the hospital, they'd be doped up on Percocet, they'd be laying in bed, going in and out of slumber while they watched Netflix. Nobody would be asking them to get up every 2.5 hours. Nobody would be asking them to take care of a very vulnerable mortal child. Nobody would be putting any demands on them other than just rest and get better, right? So this is what we expect of women giving birth surgically. So go ahead, go home and hit the ground running. Wake up every 2.5 to 3 hours for the first 2 weeks or longer and feed your baby while you're recovering from surgery. And while we pretty much tell you not to take your heavy pain meds once you get home from the hospital. On take Tylenol and or Motrin.
Yeah, I mean, it's a major abdominal surgery, and it's not even just the surgery. There's the recovery from the pregnancy as well. So it's definitely a deeper layer than a hernia surgery.
For sure.
Yeah.
So it's just, I guess what I'm saying is many things conspire to make this time difficult for moms. And the last thing we need to do is give more pressure and stress to her over how she feeds her baby. Just the other week, I was leading a new mom support group, and I opened up the topic of postpartum depression and anxiety, and every single mom in the room said all of my issues about anxiety and depression had to do with breastfeeding. Every one of them said, I couldn't believe my ears. Every single one of them. And they all looked at each other. They were like, yeah, once I just gave up on the pumping, or once I just gave up on this thing that was just not working about my body, I became a happier mom, and I finally bonded with my baby. Now, that's really significant, because we are told over and over again that breastfeeding is what bonds you to your baby in a chemical and physiological way, as well as in an emotional, loving way. When in reality, when a mom is really, really challenged by the difficulties of breastfeeding, it is preventing her from adequately bonding with her baby.
Mm-hmm. Because of the stress. Wow, that's intense. I mean, I can definitely see that. Breastfeeding is challenging for a lot of women. There's no doubt about that. I had challenges myself. And, for me also, getting what helped me to help my breastfeeding relationship with my son was having a lot of support in that area. And I think sometimes that's lacking. And even, for example, the moms coming to my practice, their newborns are getting adjusted to help with the latch. Mom's getting adjusted to help with milk supply. And if they're not coming in, the help, the support they got in the hospital was so minimal, like nobody's checking that baby's mouth for a tongue and lip tie. Everyone's telling the mom it's normal for her to have this horrible, painful clamping latch,
right.
all of that. So it's just like having the right support is so key as well, whether it's, a chiropractor, a lactation consultant, whatever, who's really supporting that mom and becoming successful and understanding that sometimes it takes a few weeks as well.
Right. And so on that note, I want to say that lactation consultants can be expensive. However, many, many insurance carriers will cover or at least reimburse you for that expense. Plus, we have La Leche League International. So those meetings are free and very supportive. And on top of that, we have new mom support groups at various hospitals that are often led by either a La Leche leader or a hospital IBCLC. And then that can also be a free place to get guidance, assistance, and support. So, I would hate to, I tell people everybody should see a lactation consultant afterwards, even if things are going well. But that is an expense. And I would hate to, feel that women are being under-supported because it's a financial burden. But that can certainly be the case in many situations. But we have free or low-cost support out there. But again, it's not just about the support. The support is one thing, but sometimes you need support to tell you it's okay not to breastfeed. Let me tell you just quickly one of my most just life-altering experiences with that. One of my students called me. She had taken my class, and she called me afterwards, very shaky. Just like, I need help with breastfeeding. It sounded like things were not going well at all. So I made time in my schedule. I went to see her that very day, arrived at her house. The baby was snoozing comfortably, and they had told me that they had been giving him bottles of formula in between her attempting to breastfeed. So we talked about a bunch of things, and then finally the baby started to wake up, and I was like, all right, well, let's see how you do with breastfeeding. Let me observe, and I'll, give you what guidance I can give you. The baby started screaming at the breast, and the mom got instantly so tense, so agitated. She started hysterically crying. I said to the dad, I was like, just take this baby and go give him a bottle. I need to talk to her. And I looked at her and I said, tell me what's happening here. What made you cry so hard? And she just collapsed and said, I don't want to do this. I don't want to do it. I know I'm supposed to breastfeed, but I don't like it and I don't want to do it. And I looked her right back in the eyes and I said, then don't. don't. Let's get your milk to dry up. Let's give this baby bottles of formula, and let's get you in a much, much better place. And just the floodgates opened. It was like the sun came out of behind a storm. She literally, like, her whole demeanor changed, and she's like, "Really? Can I do that?" I'm like, "Of course you can do it. It's going to be
even
fine."
consider it an option for herself, and that's so much pressure and responsibility that she was putting on herself.
Wow. Right. And that's so typical. That's really typical. She was already feeling emotionally vulnerable from her birth. And then this was layered, this was another layer that she absolutely couldn't cope with. So what I saw in that circumstance was she needed permission to stop breastfeeding, but she needed it from a professional, and especially a professional who is a breastfeeding advocate and counselor. But for somebody who's on that side to say, then don't do it, I mean, like, that was worth all of its weight, because it completely changed her around. But again, like, she had to hear it from somebody who, right, she believed would not steer her wrong. And I don't know this for sure, but she might have thought that my agenda when I walked in her door was to really kind of like persuade and encourage in a way that was blind to her emotions, but was fixated on breastfeeding alone. And that's what I didn't do. So it's just my hope that women working in the birth field can be a little bit more elastic on the approaches that they have, knowing that one size doesn't fit all, knowing that breast is not always best, and that we should never prioritize breastfeeding over a mother's mental health and well-being.
Well said. I think that this is just really good advice in general, and all the, women and birth workers that are listening into this, this is eye-opening, and this is applicable to any decision we make as parents and mothers, right? Everything regarding how we feed our baby and beyond is coming from really within yourself, and it's listening to what feels intuitive to what feels best for you and the baby, and not necessarily what is told to you is best, right?
That's so correct. Important. That's correct. But what's inherent to that conversation is that it takes a mother time to build her confidence and to feel that she does know the best thing for her baby. And if she's met with a lot of resistance and obstacles along the way, that can undermine her newfound confidence. So in my work, I always try to build the confidence and the reassurance that you know your baby best, and you know what's best in this situation. Don't lean on all the experts to tell you what to do. You have to find that strength within yourself. But it's difficult to find that strength when it's undermined right at the like in the moments that you are at your most vulnerable, those first few days with your baby. So on an up note, I feel like the tides are turning. I'm seeing more and more. I approached the New York Times and I said I would like to write a story about this, about the breastfeeding initiative and how it's impacting mothers' mental health. And their answer was, we have someone already working on it, but I never saw that article. Fortunately, the Huffington Post, the HuffPost, did a story about the impact of breastfeeding on the pressure to breastfeed is hurting moms, and doctors are finally realizing it. If you call up any of those keywords, you'll find an article that addresses this very thing and talks about the rigidity of the baby-friendly initiative and how harmful that can be. But they're not attacking the policy as much as perhaps I just did. They're being a little bit more sort of diplomatic about it, but still acknowledging that this kind of pressure, that's where the pressure starts, and how detrimental it can be. Okay.
Yeah. Well, I'm so glad that you took the time to come on and share. Like, this is obviously a really hot topic. It's not really being discussed maybe as openly as we would like it to be. But having these conversations are important, and that's where we can start to shift the cultural impact and possibly the policies. Because in general, I think the baby friendly initiative has a good meaning, right? And it has has a lot of positives. And I think what I'm hearing is it just has less rigidity and more flexibility is required.
That's correct. Its intentions are admirable. The way it's being carried out is questionable.
Yeah, I hear that. Any last thoughts you want to share with the audience?
No, I mean, just that, for anyone listening who may be in that kind of realm of either worrying about a postpartum mood disorder or possibly in one, fortunately, we're in a great place culturally that this is so well accepted and known and recognized, that the help is out there. It's readily available in all forms, whether it's psychotherapy or social worker, a new mom support group, a postpartum doula. There are many, many different ways to get relief from these emotions that you're having and feel the support that this is a temporary issue and that will dissipate as you move further into your role as a new mother. Okay, I didn't say that very eloquently, but
No, you did. So Jayne, I really appreciate you taking the time. I appreciate your passion for this topic, and just thank you again for coming on the show today.
Okay, thank you so much for having me.